Hi, this is your Chief Science Officer, Brazos Minshew. Welcome to Wellness Talks. Today we have a very special guest and a personal friend of mine, Dr. Jeffrey Robinson, who's going to speak with us about his area of specialization, which is chronic pain and inflammation. So welcome to our program, Jeff.
Thank you for having me.
Well, you know, we are dealing with a nation that's literally on fire, people who are experiencing pain and inflammation, and you're the expert. So tell us a little bit about the process of inflammation. What does it mean? What does it do? What is the function of inflammation?
You know, the function of inflammation is an initiation of a healing response from the body. It can be caused by a number of different things. I see a variety of conditions in my office that show inflammation and come from a number of different sources.
So injury, for example, a good cause of inflammation. How about chronic toxicity or nutrient deficiencies?
Absolutely. Today's patient's a much more difficult patient to treat. They've all presented with those types of symptoms, and the good doctors, the good pain doctors out there will realize that and use a multitude of different modalities to treat that.
Stress?
Stress is another big factor as well, combines on top of the toxicity to create even more complex patients that have more inflammation.
Wow. And you mentioned a moment ago that pain can actually be something that's caused from the outside or from the inside. Give me a good example of pain from the outside.
Pain from the outside would be someone at the gym who does too many of one exercise or does a new exercise they're not used to and creates an inflammatory pain.
Okay.
That's less,
auto accidents?
Even more so. Whiplash case, tearing muscle, tearing tissue, all create inflammation.
Falls, injury, slip and fall. Yeah.
All acute injuries, all are creating inflammatory cycles that can affect any part of the body.
Okay, but just to hold that thought for a moment, we said that that was part of the healing process. So it's the way your body's trying to deal with those injuries. What about an injury from the inside? How does that, what might that look like? Give me an example of an injury from the inside.
An injury from the inside may look like someone with a stomach problem. Let's say an ulcer. That's a great example of inflammation from the inside. That can be caused by a food, a bug, or something of that sort that's creating an inflammatory cycle on the inside. Some patients know about it, some patients don't. Atherosclerotic plaquing the arteries, another form of inflammation.
So heart attacks, strokes are also part of the inflammatory process.
Correct.
Very interesting. And do they exhibit with some forms of pain from that kind of inflammation?
Some do. Those are less likely patients I'm going to see in my office, but they are things I have to recognize and get them to the right provider. But I do see other forms of inflammation that start from the inside that do create pain. Let's say a rheumatoid arthritis patient may have food toxicity issues or other environmental toxicity that is attacking joints and creating inflammatory pain.
Right, that's the autoimmune response, and that creates pain. True?
Absolutely.
Yeah. What's the function of pain? What's pain really do for us?
You know, pain, I would say, is a signal from the body that something's wrong. It's telling us that there's a problem in an area of the body and maybe telling us not to stop doing something.
Okay, so if the stove is hot, take your hand off.
Yeah, that's a great, yes, okay. Absolutely.
All right, very good. Now, we mentioned a moment ago that there are certain nutrient deficiencies that can actually create pain. Can you elaborate on what those might be?
There's a number of nutrient deficiencies I think that can initiate pain. Magnesium is probably one of the most common ones that I see. Other ones that you may encounter could be bioflavonoids. Bioflavonoids are very involved in collagen production. Deficiencies in bioflavonoids would possibly cause a ligament or a disc type pain. Okay,
so we're talking about connective tissue pain.
Correct.
Right. They're very good. Do you ever see any individuals whose pain is worsened by other deficiencies? For example, if they're not drinking enough water or getting enough sleep?
Again, in my practice, I see quite a few disc-related pain syndromes. Dehydration is a huge problem that can cause a collagen-type pain from a dehydration standpoint. Again, when you talk about collagen pain or ligamentous pain, certain conditions in the back, in the elbows, shoulders can all have ligamentous origin to them, the collagen tissue.
Wrist, how about carpal tunnel?
Very common, very common. I see a lot of golfers, a lot of active people with that type of problem from repetitive use that does lead to a breakdown in that collagen ligamentous tissue in the wrist.
So from the inside and from the outside. And you mentioned magnesium. We have an excellent supplement that's very, very high in magnesium. It's a form of a multiple vitamin called Welavo, and it's probably the highest magnesium supplement we have. We do have a number of others that are very high in magnesium as well, but this is probably our chief However, the premier product that Trivita has is Nopalea, which contains bioflavonoids in the quercetin family that are called betalins. And the betalin bioflavonoids are actually put out that fire of inflammation. But we discussed the process of inflammation as being the trigger for pain. And we also discussed that pain was giving us a message. What if we are able to reduce the pain, but what if we're able to reduce the inflammation, but the pain really doesn't reduce concomitantly or at the same time? What may be causing that? What may be one of the irritants that can create pain, even though the inflammation is starting to drop?
Again, what is the origin of the pain? And that's one of the things that I try and establish in my practice when I'm looking at a problem. What tissue, what origin is it coming from? Is it a muscle? Is it a ligament? Is it a nerve? Is it a disc? Is it a joint? Each of those structures are going to have different components of what can create the pain. We talked before, again, about a deficiency or toxicity. If I can identify that it's a muscle that's causing the pain, maybe it's a magnesium deficiency. Maybe it's a lactic acid accumulation from overuse, creating a trigger point that I need to do a musculoskeletal type technique on it to remove that.
So you'd classify lactic acid buildup also as a toxin?
Absolutely. Again, a product of dehydration, of overuse, of chronic overuse to accumulate these lactic acid type pockets.
And how about environmental toxins?
I see them all the time. Very common in today's society. We're going to see environmental toxins, mercury, aluminum, formaldehyde, acetones. All of these play a part in terms of creating a inflammatory cycle. Difficult to diagnose, but definitely play a role in inflammation.
And that can create the pain then?
Absolutely.
Sure.
Pose a difficult type situation to pain doctors, because when all other sources of pain have been removed, you then have to start looking at those types of sources of pain. And in complicated patients today, it's definitely something we need to address.
Yes, right. So in this case, using some form of detoxification then would be the appropriate way to deal with chronic pain.
Absolutely. It's a key component that I think in my practice anyways allows me to get patients a result that may not otherwise be achieved through structural means.
I understand that there is a strong relationship between chronic pain and unrelenting pain and vitamin D deficiency. Can you speak to that?
Very common in today's society. We're an indoor society. We're a sunscreen society. We originally weren't intended for that. We were meant to be outside, gathering sunlight, playing golf, and using that vitamin D in all the ways that it can be used to support the immune system, balance the immune system, and also curbing inflammation with that as well.
Yes, vitamin D is an anti-inflammatory. That's very interesting. As we've discovered that there are some elements where vitamin D actually plugs into the nervous system, and so therefore anybody who has chronic constant pain can benefit very frequently from taking vitamin D. So we've talked about the bioflavonoids as being a good way to break that pain and inflammation cycle. Now we've talked about magnesium, and we've talked about vitamin D, but we've also had the discussion about some of the deficiency states from other things: sleep, water. What would be another? Exercise?
Exercise could be one. Possibly zinc deficiencies could be another source of that as well. Again, you're talking about the muscle tissue. We talk about magnesium as being one. We talk about calcium as another. Deficiencies, different sources of that can create that type of deficiency. Again, the most common ones I see in my practice are typically zinc and magnesium and dehydration.
And bioflavonoids. Yes. And then we also have toxins, like environmental toxins. And you had mentioned something about food toxins. Can you kind of give us a synopsis of the most common food toxins that are associated with inflammation and pain?
Absolutely. And I've been made aware of this in my practice, again, dealing with these more complicated patients and trying to solve these patients. Gluten. We all know today about the effects of gluten, gliadin, and wheat. And numerous patients in my practice have shown inflammatory pain cycles that I believe were initiated by a gluten-wheat intolerance that then carried out through the body in an autoimmune type fashion, affecting every joint in the body in some cases, certain parts of the body, and making it very difficult to really curb that pain.
Okay, so gluten is one. What are some of the other top offenders?
Casein milk products. Again, you're dealing with casein, which is a very difficult protein to digest. Other ones that include, you're going to see eggs. Eggs a lot of time could cause problems for individuals.
Soy?
Soy is another one as well, a difficult protein to digest.
Yeah.
And also there's members of the nightshade family that I think also pose difficulty.
Especially with rheumatoid conditions, true?
Absolutely. These patients are very special and have an autoimmune reaction that can be aggravated by a number of different types of foods.
Okay, so we've talked about injury, and we've talked about deficiency, we've talked about toxins, and the last thing that we'll discuss is about the effect or impact of stress on chronic pain. But we're going to wait till we have another time to get together. Great. And we're going to have an entire show just strictly talking about the pain and inflammation cycle as it relates to stress. So thank you very much for coming on the program today.
Thanks for having me.
Remember, you've heard many different remedies that you can all apply to all the conditions that you might be facing that are surrounding pain and inflammation. But we have some remarkable products and some remarkable ethics, some things that we can do for ourselves that can really help us reduce that pain and inflammation cycle. Inflammation's our friend as long as it's kept in balance, and health only comes from healthy habits practiced every day. So until next time, have a great day, and we'll see you again.